Hey, everybody, welcome to this episode of Compassion and Courage Conversations in Healthcare. I'm your host, Marcus Engel, and this is the podcast where we teach compassionate communication, provide perspective, and inspire resilience. Today, my guest is, well, first of all, I'm woefully unprepared because the question that I should have asked you before we started recording was, Melinda, how do I pronounce your last name?
Shultice.
Shultice. Okay, so Dr. Malinda Shultice, thank you so much for doing that. That is significantly different than how my computer pronounced it to me.
I believe it.
So, well, I'm excited to get to talk to you because you've got several different realms of experience in healthcare, and you're a leader and teach leadership. So where should we start out today? I guess one of my questions is I'm here in one of the studios here in my house in Orlando. And where are you today?
I'm in a very dreary, chilly Des Moines, Iowa.
Dreary, chilly Des Moines, Iowa. Okay.
I feel like I'm in England right now. That's what it looks like right now.
Very nice. I love England, so I might love Des Moines right now.
Yeah.
Good stuff.
Yeah, I live here in Des Moines, and I teach at Iowa State, which is just up the road from here.
Excellent. And you have you're a doctor, but tell us what kind of doctor you are.
I am the type that if someone is coding on the sidewalk, you're still going to want a medical professional because I'm not that type. Yeah. But, I started off my career accidentally in senior living. And when I say accidentally, I mean accidentally. I needed a job in college. And so I started working at a retirement community and had never even walked into one. No idea, no healthcare background, any of that. And I walked in and I was petrified because it just looked like your everyday nursing home that you would think of, back in the 70s, 80s. And by the end of the shift, I was a dietary aide while I was going to school, and I couldn't imagine not working in healthcare. Like my entire psyche shifted in a 6-7 hour period. And I couldn't imagine, I didn't know what my future looked like, had no clue, in fact, but I just knew that I belonged in that realm in some capacity. So when I left school, I had gotten my master's degree in public administration, and I honestly thought I was going to go into some governmental entity. And then after working that part-time job, I thought, what am I doing? Why am I not managing retirement communities? And so the administrator at the time of that building said, why don't you do this after you graduate? And I'm like, quite frankly, ma'am, I don't even know what it is you do. I don't even understand your role, your scope of practice, all the ins and outs of it. And I pursued that career, and I did that the last 10 years. So I managed very large retirement communities that were predominantly, private pay, very affluent. And then I also managed the Medicaid-based communities in rural parts of Iowa. And so I had completely different scopes that I had dealt with, but it helped me to grow up as a leader and it made me a better person. In the midst of, I was completely ill-prepared for the job that I was doing and gifted. But as you can imagine, healthcare, it's heavy. And when you give so much of yourself, and now she's almost 9, but I had a young daughter through the midst of all of this. And I missed so much of her childhood just trying to do the right thing for the residents and my team. And so about 2 years ago, I quit. I quit and pursued teaching. I was getting my doctorate degree in health sciences during that time. And I think I knew I wanted to teach, but that was not the plan until I was like 75 plus years of age. I had no intention of leaving the healthcare realm fully day to day. But I got to start teaching in their business management program. And so now I get to teach college students about healthcare management and all the things that I wished I had been prepared in. The other thing that I do, though, healthcare just leaves such a lasting impression on you. It kind of ruins you for every other industry because you don't necessarily get those feelings or that fulfillment in any other job, good, bad, or indifferent. So I really tried to focus on the parts of my job that kept me in it for so long, even when I was burned out and couldn't do it anymore. What kept me coming back? And it was me watching other people grow into the leaders and the people I knew they could be, watching my team succeed made me so happy, because then that made the resident care through the roof great. And I liked watching that. And so then I thought, okay, how can I go help other communities that are struggling, or healthcare entities? Because this is now broadened further outside of senior living than I ever intended. Because that compassion, which drew me to your story, that compassion piece, so many people are well-intentioned, but the healthcare community is struggling and has struggled for so long with turnover, morale, all of those things. And then in the midst of it, we're supposed to be taking care of some of the most vulnerable humans. And how do we do that when we don't take care of ourselves all that well? So that's become kind of my obsessive mission, is how can we gift pockets of time back into our healthcare leaders' day to where they're more effective in their spheres of influence, because they can lean into that compassion and that empathy and that curiosity without losing the tasks in their day that they have to do. So that's really what brought me here today.
Well, so how do those leaders do it?
How is it now?
Well, how do they carve out those pockets of time, I think, as you described, that can help connect, stay connected in some cases, reconnect in others?
Yeah.
How do leaders do that?
That's a fair question. And because the reality is, in any healthcare leaders day to day, no matter what, industry they're working in, it can be heavy. You can have a really difficult, vulnerable conversation 1 minute, and then 30 minutes later, maybe you're giving an employee review and it's really top notch and it's an exciting conversation. And then another 2 hours later, maybe you're talking about hospice with someone. Mm-hmm. So there's that heaviness and that busyness throughout the day. And we have all these tasks we still have to complete. But so one of the first things that goes for leaders, whether they intend for this to happen or not, is our ability to hear a person's story within their story, that compassionate leadership, because we get busy and people stop prioritizing that. But that's really that connectivity piece, even if it's 5 minutes with a patient or a staff member, and teaching yourself to actively listen as the leader and not coming up with a solution, not trying to solve their problem like we're always constantly doing as a leader, but just being quiet, letting that person talk and giving space to hear that story within their story. We can solve so much for our patients and our residents and our staff if we just do that as leaders, but we don't do that very good as leaders. So these small pockets of time is what I've been trying to teach people to optimize. And we've also lost the ability to actively listen. We're not very good at that either as leaders. So that's really kind of what it looks like in context. It's very simplistic.
I feel like we're not just poor active listeners as leaders. We're poor active listeners as human beings these days.
Yes.
With so much distraction.
Yes.
Whether self-inflicted or media inflicted, however you think of that. And that's where, whenever we first started talking, I was like, okay, here's somebody who gets it, who gets this idea that we've got to be present. We've got to slow down and stop and sit in stillness and be present so that we can stay connected with why we did this in the first place.
Yes, 100%. And, the other thing that happens, if we can actively listen long enough to someone, whether it's in our personal or our professional life, but especially in these leadership roles, we constantly think that we have to strategize and solve problems for people. And sometimes that's the case, but we really don't set people up for success that work for us, because we constantly are, taking those opportunities of growth away from them because we're enabling them instead of empowering them to find solutions on their own. We're not very good at giving people, because we're busy, we want to just spoon feed them the answer so they move on with our day or their day, and we can get back to what we're doing. And we didn't actively listen. We probably didn't really solve anything for the long haul. We just gave them a quick answer to shuffle them along. And that ties back to what you're saying, is not only are we not great at active listening, but we enable, because we don't empower people any sense of ability, to discover, or, it doesn't take long for people in a conversation to sometimes discover that actionable step of something they can walk away with and own, instead of the leader having to constantly brainstorm and strategize for them. So it's kind of twofold. We're not great at active listening, but we are really good at enabling too. And it's an interesting paradigm that we're in as healthcare workers, for sure.
Yeah. As human beings
Yeah.
too.
Yeah.
You mentioned earlier that people go to work and they're doing heavy work. They're, as you said, a variety of highs and lows, all within a 8 or 12-hour shift.
Yeah.
What are some of the techniques, or can you give a technique for how to stay engaged when I feel, I guess I'm trying to frame this in a couple of different ways, but I feel like whenever you go up and down, peaks and valleys, right, of emotional highs, and
Mm-hmm.
then some, as you said, you have to talk to a patient and family about putting a patient on hospice.
Mm-hmm.
And how do you then stay engaged when I think it might almost be part of our nature to disengage a little bit
Yeah.
because the lows are too low and the whiplash effect emotionally
Yeah.
is tough?
Mm-hmm. I mean, that's a great question because, if you're any sort of an empathetic type, you can have the energy stolen from you very quickly if you don't, try to foster that and protect that for yourself.
Hmm.
Oftentimes, one of the most effective methodologies that I work with people is trying to find that middle ground by being your authentic self, but not trying to give every ounce of your energy in that moment that you can. So it really leads into, I work with people on emotional intelligence because, as leaders, some are really great, or some are really strong naturally on being emotionally intelligent, being able to read the situation, how much emotion you can and should bring to the table, how to help your team also try to control that. Some leaders are really good and some really struggle with that. So I would say one of the things that I work with people in that exact situation that you're talking about, knowing that our days can be really beautiful and blissful while also heavy, at the same time, is working on honing in on that emotional intelligence and figuring out a way to ground ourselves in each different situation. And it really, every situation, if we should be present in it as leaders, we should be listening, we should be engaged and not treat every situation the same, because no two situations are alike in healthcare. And so if we can actively listen and we can work on our emotional intelligence that we can bring to the table, you can really help to balance out. So you're not constantly bottoming out after a bad conversation and you're not riding this, unobtainable and unabstainable high after a great conversation. So it really is about being emotionally in tune and in balance with the situation, but also just being engaged enough with the conversation to know where you fit, how much you should and can bring to the table. But really that leans into that leader needing to be actively present in the situation and not with your mind halfway on the 40 other things you have to do after this. And so that's how you can help to manage and regulate your own emotions throughout the day, is by being present and also working on those emotionally intelligent core values per se.
So you say emotional intelligence, and I've been a big fan of the book.
Yeah, it is great.
What else is on your reading list right now, or what's a book that you're enjoying?
I like Big Magic by Liz Gilbert.
Okay.
And I also like Atomic Habits. I am trying to be better at habit stacking, and maybe you can understand this as an entrepreneur. The healthcare industry as a whole, I look at it as an entity that I want to try to heal. It needs healed. Not only do the patients and the staff need healed, but the system itself needs healed. And that can feel heavy and overwhelming when you're only one person and you can just try to tackle what you can in your sphere of influence. And so, I get overwhelmed or I feel guilty, like I always should constantly be doing more. And that's what led me to my burnout problems in the first place. So I'm trying to get better at habit stacking with my day so that I am in tune. I can get into like a heavy flow state, but then I can come out of that and still be a functional human, because those work-life boundaries, that's kind of a facade. That's a facade phrase when it comes to healthcare. And so trying to learn boundaries and habit stacking is why I'm paying attention to both of those books. But the big magic one is really, when I was trying to heal from the career that also shaped me as a human, that I'm eternally grateful for, I lost that sense of magic and that curiosity behind all of it, and my why, about why I got even into it in the first place. And that book kind of helped snap me out of that funk I was in, because I didn't feel like myself anymore. I think I had outgrown my job, but that's really hard to admit. But I didn't know what was next. I was petrified. So those books kind of helped to realign day to day how my new path that I'm on, I guess you could call it.
I love that concept that you just say about, I outgrew this job.
Yeah.
That maybe sometimes we're not burnt out or compassion fatigue. Maybe it's we've outgrown the job. And maybe there's another new challenge over the horizon. And hopefully it's in leadership.
Yeah, absolutely. I don't think people have to get to the point where they feel like their only alternative is to leave fully. But there should be some conversations. Had I been more intuitive with myself and engaged, I think I probably could have still been in a healthcare leadership role. But because, in senior living, there's only so far you can get capped. I probably could have looked elsewhere, but I was in just this state of, I thought I was burned out, but really now that it's been almost 2 years and I've had time to reflect, I had outgrown the role. So it was, I didn't have anything to give the job anymore, because it was no longer in alignment with who I was and what my values were. And I changed, what I thought I wanted in my 20s, you think you want the title and the money and the status. None of that rings true for who I am now in my 30s. I am not in alignment. I'm just not the same person. And so I think that's hard for healthcare people, though, that have gone through so much schooling, especially if they're clinical, to then have that conversation with yourself that, okay, what's next? That's scary for someone who thinks that they have their whole career trajectory mapped out. And so it's much easier for people to just continue on and push through the compassion fatigue or burnout or not wanting to admit the growth. It's easier for people to stay on that path than having to maybe look at doing something different, because that's scary. People don't like change. Change is scary for most people. So
speaking of change, one of the questions that I always ask is, that's coming, is to share a narrative about a time that someone was there for you or that you were there for someone else. Is there a particular story that comes to mind whenever I pose that question to you?
Yeah, so when I was in school, this is more of a personal part of my life. When I was in my undergrad years, I got pregnant. So I was that student I was 19, almost 20 years old, got pregnant with my now husband, very unplanned. And I was that kid sitting in class pregnant. I was a kid getting ready to have a kid, and found out about 6 months in that something was wrong with her. And she ended up passing away from complications related to spina bifida and hydrocephalus. And I had no idea what any of that was. Yeah. And so I remember, I had a couple of professors that I was of the mindset that I needed to just bounce back and get back into school, because I didn't know if I would ever go back if I allowed myself too much space. And I had a specific professor that had really kind of pulled me aside and said, they didn't really care about me as a student any longer. It was now just person to person. And they pretty much taught me how to prioritize myself rather than just bulldozing through trauma and acting like it didn't exist. Because that was my original plan, was to do that. And so that was the first person that, really kind of taught me some adult, harsh life lessons. And to not prioritize, what I thought my professional aspirations should be, and to really try to focus on my personal personal growth. In that same scenario, I also had, and there's a part in one of your books that reminded me of this. But before I had my daughter, the one that when I was during my undergrad years, before I gave birth to her, because I had to give birth to her because of our serious situation with her health, I remember that she grabbed my hand and she didn't say anything to me. She just squeezed it in this very loving way. And there was this part in your book where it reminded me of that, because I can't recall exactly who the character was. Maybe it was Barb, the nurse, or maybe it was one of the other doctors that came in and squeezed your hand. But just knowing that another human was there, and it was a traumatizing time that was very humanized. And so those were two examples that have stuck with me, the last 16 years. And that's what continues to draw me to this healthcare field and probably academia, because I want to be that for another student down the road. I feel like I owe that to the world because someone did that for me. So that's how I would say my care question would go.
When you tell the story from beginning to end, you see the redemption in the story.
Yeah.
Right.
Yeah.
You take the negative, and I think you use the terminology earlier, you bulldoze on through it.
Yeah.
And hopefully we can take that learning that life lessons that come along the way, and those relationships and those moments, and capitalize on those to just continue that same sentiment.
Yeah, absolutely. And if you would have told me as that undergrad kid going through all of that I would end up, because I teach now at that university.
Mm-hmm.
So I'm walking the same steps that I used to, after going through all of that. And now I get to go in some of those same classrooms that I was a student, however many years ago. So the fact that my life has come this full circle and that I get to give back in that way sometimes doesn't feel real, but I think I'm there for a reason. And sometimes you don't realize how pivotal those moments are, no matter how small they are. Sometimes you don't realize the weight that they carry in a good way until you're able to actually reflect later on, and how much of an impact I'll probably carry that with me forever, because it still feels just as fresh in my mind today as it did, 16 years ago. And so I want to be that for someone else. Whether I ever hear from them again, I don't know, but I want to at least be that for someone.
It's what we get to do, right? We get to do that.
Yeah, absolutely. And that's what one of my biggest takeaways from your podcast and your book is we get to be that for someone. And I don't think I could really find much better purpose for my why than that, because some people search for a long time to figure out their why, and some people search for a very long time to figure out what their purpose is. And I feel grateful that I've had, as traumatic as some of the situations that I've gone through in my life, they've gotten me to where I am, that I can help others. And I'm grateful for that.
It's a redemption. That's the redemption.
Yeah. I can't think of a better word than that.
Well, Melinda, thank you so much for spending some time with me today and sharing your wisdom and insights and stories. And thank you for your openness as well.
Yeah. Thanks for having me on.
Yeah. If there's people want to reach out to you, how do they get a hold of you and learn about the work that you're doing, or want to get leadership coaching, or et cetera?
You can go to my website, melindashultice.com, or you can also find me on LinkedIn. I'm constantly on LinkedIn. I find it a very valuable resource for all the cool things that people are doing around the world in our healthcare realm. So either or would be a great option.
Great. Well, Dr. Melinda Shultice, thank you so much for being with me today. And listeners, thank you for being part of this episode of Compassion and Courage. Again, I'm Marcus Engel, and this is the podcast where we talk about Compassionate communication, providing perspective and inspiring resilience. For any kind of keynote speaking needs or books or consulting or narrative medicine workshops, please reach out via marcusengel.com. Thank you all so much for being with me, and we'll see you on the next episode.